Aortic cannulation. So in this exercise, we'll review aortic cannulating stitches. These typically involve 2 forehands and 2 backhands. So you start on the right side and end up on the right side. Most people will use an inner and an outer purse string. Some will use pledgets. Some will use different types of suture material. We're just going to focus primarily on suturing a purse string around a designated spot on the aorta. So the first forehand, notice it has a little bit of a forward going angle. So it's at about close to a 45-degree angle on the needle, but not quite. So it's forehand with about a 40-degree angle. Typically the needle goes through adventitia and just a bit of the media. When I reload, I like to reload my needle on something, on material, and I get it ready for the next forehand. This next forehand is pitched a little towards me so that it's so-called hook, and it's still at about 40-45 degree angle. What you can't see is that I actually have my fingertips at the edge of the box, or in a human it would be on the skin level, to support my hand a bit. Everybody has a natural tremor. So you go in with the needle at about a 90-degree angle, and you come out. And so the ratchet, I tend to keep the ratchet on the castro. In other words, I keep it locked as I'm driving it through the tissue, especially if it's harder tissue, but I release it immediately as the needle comes out. You don't want to have undue tension on the tissue. So now the next one is going to be a backhand. So we can just kind of flip this needle around to a backhand. It's going to be a backhand with a 45-degree angle, and really not much of a pitch in either direction. You can kind of pull the purling through a little bit. And you want to be symmetrical, so this gap here is symmetrical to that gap here, and we want to have another one here and another one here. Some folks use a hexagon. You can do a square. I tend to do a hexagon in real cannulating, but this is mainly just to show the exercise. So again, needle goes in, not too deep, but not so shallow, and comes out. Now this last stitch tends to be one of the hardest, and it's really a forward pitch. It is backhand, forward pitch, and about a 45-degree angle. And what we're trying to achieve is go from here to there. So we're sliding in. And I use this pickup a lot to kind of push tissue down gently. You really don't want to grab the needle tip much because you can mess up your needle. But there are times when you have no other form of pulling it out. So when you're done, what you'd like to see is a nice circle around what will then become an aerototomy, a small incision. And that incision is usually going to be maybe 4 millimeters, 4 or 5 millimeters. This is an 8 millimeter defect because it's what we use for the coronaries. But in reality, you're going to be making maybe about a 4 millimeter defect or 5, depending on the size of your cannula. So in summary, forehand, forehand, backhand, backhand for the aortic cannulation.